to me, the essence of what's going on both on the national level and the state level is universal coverage. And costs at a sustainable level are are what makes universal coverage work. And I think we're getting down to brass tacks on both the federal and the state level, but we're at very different places. And I think we tend to forget how different we are here in Massachusetts from the rest of the country. We are at stage 2. They're at stage kind of 1/2. And we're getting an echo here, aren't we, somehow? So I don't know if we move that further away or something, but can you hear me now?
Yeah.
Okay. With our market rules here in Massachusetts, which in some degree exists, in varying degrees exists in the other New England states and in Pennsylvania, New Jersey, and New York, but not in the rest of the country, we were ready for the stage of shared responsibility because we were not selling coverage to people based on discrimination on health status and many other things, including gender and so on. That's the way business is done in the rest of the country. Bruce is right, and it's actually done to make insurance more attractive to people by having lower premiums. The left, which, by the way, if you haven't seen on YouTube the new MoveOn.org video, which goes beyond just vilifying insurers to really very creatively vilifying health plan CEOs. You'll really enjoy it. Someone sent it to me this morning. The way we do business here is so different and so much more dedicated to having everybody covered. I saw a very interesting statistic yesterday, and it's amazing what you can do with statistics. And this was put up on a screen by Dr. Jim Mongan, head of partners. And it was a question, it started with a question. The percentage of family income that goes for health insurance premiums in Massachusetts is first in the country, third in the country, fifth, or 40th? And of course, you know, partners wouldn't put it up on the screen if the answer weren't 40th. But that is the Commonwealth Fund statistic. And it's because we have a higher standard of living here in Massachusetts than the rest of the country, and a higher cost of living than the rest of the country. And then he showed the Boston Globe article that actually reported this in August. And yes, that statistic, that we are 40th in the country in the percentage of family income that goes for premium, it was in the article in paragraph 8 after you turn to the jump page.
Yeah, right.
The headline was, "Mass Premiums Highest in Nation." Well, that's also true, but as a percentage of family income here, we are way down. So we have a cost problem. Everybody in the country has a cost problem. We are starting here, having started with coverage, which is where I personally believe you had to start, or you'd never get to the cost question. Now we're turning to the cost question. And exactly what the new shape ought to look like, we're going to have a lot of debate. The legislature is going to start hearings next month on the Payment Reform Commission recommendations. And I don't think there's any sort of preordained place that's going to come out, but it's going to be a very serious discussion. The rest of the country, not just state by state, but the feds who have the power to do things in different ways, isn't anywhere near that yet. The cost savings that they're talking about in the federal legislation it's sort of what, from our Massachusetts point of view, I think is so last century. They're really talking about how do we cut premiums. That's not the same as cutting costs. When 90% of the premium dollar goes to providers, cutting costs has to do with the underlying costs for physicians, for hospitals, for pharma, and so on. That's what the Payment Reform Commission regulations start to get to. How proposal from some rural folks that Senator Schumer from New York seemed to be going along with would affect a mostly urban state like Massachusetts. It's going hot and heavy. But we've done things with the individual mandate, which, you know, President Obama actively opposed that in the campaign. And now if you listen to him since the speech before Congress, he's supporting that. With the safety net and coming up with a formula that applies the safety net to the self-insured here in Massachusetts. And we're doing other things that sort of go in the other direction, like the assessments against health plans to fund some other things that state government does that makes it more difficult for us to provide affordable coverage to everybody. You know, there's been a fair amount of publicity as part of the political effort to get this all rolling about, you know, hospitals stepped up with a certain amount of dollars. Well, what they stepped up with is disproportionate share funds. That gets you right back to the problem that we're facing here in Massachusetts of there still need to be safety net hospitals. How do you fund those safety net hospitals? Pharma stepped up with subsidizing brand name drugs in the donut hole. Good for people who need the brand name drugs. To me, it all comes back to the philosophical question of shared responsibility. We bought into that. I'm still there. I've seen some implication in the press lately that healthcare reform in Massachusetts has raised medical costs. I don't think healthcare reform has raised underlying costs. There may be more people getting access to care, and we're paying for that. But unit costs and utilization per member, healthcare reform hasn't affected in either way because it didn't set out to do that. It set out to do coverage and then tackle costs. That's the challenge where we're going to have to show the country next what the path is.